Is it on? Okay. There we go. Good evening. Everybody's going, whoops. Oh, just leave it there. Okay. Thank you for coming, and welcome to the Orleans Citizens Forum on ticks, tiny ticks, big trouble. And as our information that we gave out earlier said, we are going to have the Guinness Book of Records shortest annual meeting preceding that. It is a requirement that we invite our members once a year to attend an annual meeting, and one of the privileges of membership is voting. I'm Elizabeth DeLima, President of the Orleans Citizens Forum. And tonight we are very fortunate to be able to be here in Town Hall because we are conducting this forum in cooperation with the Orleans Board of Health. Your current members, I think you were greeted at the door, and you should have an agenda and the minutes and a treasurer's report in your materials that are there. So if you could refer to them so that you can vote with some knowledge, that would be helpful. Okay, the annual meeting will come to order, and I'd like to start with the asking for a motion for approval of the minutes of last year's meeting, which are in your possession if you're a current member. All right, it's been moved and seconded that we approve the minutes of last year's meeting as circulated. All in favor? Aye. Opposed? The motion is carried and the minutes are approved. We'll move next to the treasurer's report. That's also in front of you. And I'd like to ask if there's any discussion on the treasurer's report. You will note that we run this organization on a shoestring, and it's your contributions that make these forums possible. I'd like to ask for a motion to approve the treasurer's report as of June 1, 2010. So moved. Do I hear a second? Second. All in favor? The treasurer's report is approved. Now the the membership report is coming up next, but the membership chairman is still out there. But yes, please. Can I do nomination? Our nominating committee member, Abby Summerskill, is here, so we're going to have the nominating committee report to precede the membership chairman's report.
For the members, if you note on the back of your agenda, you have the slate of officers who are proposed to be elected. Past President Ed Moss for yet another year until he is succeeded, and myself as secretary for 1 year rather than the usual 2 years. And then if there are any nominations from the floor, we'd be delighted to get them. Are there any nominations from the floor? No one. With that in mind, may I have a motion to approve the election of the slate as appears on the materials in front of you? So moved. May I have a second? Second. All in favor? Aye. Any opposed? The motion is carried and the slate is approved. I should note that the list of board members just below the slate were elected by the board of directors to fill a vacancy on the board during this past year. And you, as members, have the right to disapprove any or all of these board-elected members. Speak now or forever hold your peace. And hearing just silence, the board members who were elected by the board are, in fact, still board members. Thank you.
I'd also like to thank John Hodgkinson, who has completed his term of service and is retiring from the board as of this meeting. Now I'd like to move to the membership report. Elizabeth Kiekenmeister, who is our membership chairman.
Thank you, Elizabeth. I'm new to the Orleans Citizens Forum, and I've been entrusted with being the membership chair, and I'm filling very big shoes that belong to John Ostman. So my job was made very easy. Our membership has grown this year, and I think that reflects the fact that we are providing something very valuable to the citizens of Orleans. We're now standing at 178 members. 61 of these members are new, and we think that's very exciting that we're culling more people in to join us. And as you've seen as you come in tonight, for those of you who haven't joined, we do urge you to take a look at the envelope and consider joining us. We are providing a very important public service. And I would also like to thank Mr. Robert Baker of Yarmouth, who did come through and has joined us, so thank you very much. So onward to a very exciting and important evening. Thank you.
Is there any old business anyone wants to bring up? Any new business? I'd just like to say for new business that we do more than one forum a year, and we've also done a candidates night just in the past month. And in the fall, we're very excited about planning a forum around economic development in Orleans, and you'll be hearing more about that later. Also, those of you who are members or who join us will receive a summer edition of our newsletter called The Observer. There being no further business to conduct, I make a motion to adjourn the 2010 annual meeting of the Citizens Forum. Do I hear a second? All in favor? Opposed? The meeting is adjourned. Okay. And now it's my pleasure to welcome the members of the panel. We're really fortunate to have a panel so eminently qualified to address the topic of tick-borne diseases. Our moderator, George Heufelder, seated in the center, who is the director of Barnstable County Department of Health and the Environment. His organization serves all 15 towns' boards of health. So it's quite an umbrella organization. Academically, Mr. Heufelder holds a Master of Science in Biology. So again, very qualified. George, I'll turn it over to you to explain the format for the evening and introduce our panelists.
Thank you very much. I'm really honored to serve you as your county health agent and to be here to serve as moderator to the panel for the Orleans Citizens Forum, which is also being sponsored by the Orleans Board of Health. A few housekeeping things right off the bat. You may notice the table over there to my right, your left. There are many handouts relating to the information that you'll hear tonight about Lyme disease and tick-borne illness. And I would like to mention that the focus of tonight's forum and the information you'll hear is on prevention and detection. You'll hear a lot of discussion and perhaps some discussion about medical symptoms and things like that. But I would like to caution you about taking anything that you would hear in that vein home and take it to the bank, but rather, if you have questions relative to Lyme disease in your person or somebody you know, the best person to speak to is your personal physician. So I'd like to sort of start off with that. We will have some short presentations tonight. There'll be two. And you have all, or most of you, have some pencils and cards that as questions arise, you want to write those down and hand them over so that during that portion, when we're answering questions, we'll be able to direct the question to the correct panelist for the information you need. So they're handouts. The cards are in your hands with some pencils, and I'm hoping that most of you are here to get some good information on tick and Lyme disease this evening, as well as other tick-borne illness. If you're here for the Lamaze class, that's downstairs in room 1. I'll start with an introduction of some of the panelists. To my far left is David Simser. He's an entomologist with the Cooperative Extension Service. He's been with almost 15 years. And I'll tell you, as a county health officer, I've used him as a resource many times because I do not believe there's anyone on Cape Cod who knows more about the incidence of the tick, the incidence of the disease within the tick, as Dave Simser. He's out there on the front lines doing surveys each year, and has been very instrumental in forwarding that information not only to the state but to citizens so that they can get the best information on where the ticks are and how to avoid them. His department also has a lot of information on reducing ticks on landscapes and other issues that you might have relative to tick-borne illness. Next to him, Dr. Robert Labdon. He was one of the early members of a Lyme disease task force that we put together in Barnstable County under my director, previous director, Stetson Hall. He has practiced veterinary practice here in Cape Cod for at least 35 years and is an clinical instructor at Tufts Veterinary School. Let's see, on my far right, there's Bob Canning. You're a health agent. Bob's been a health agent here for 25 years. He has a master's in public health. He's very knowledgeable about public health issues in the town, and we're going to probably hit our first question to Bob. Dr. Gay Freeman is practicing physician at Crossroads Medical Family Practice Clinics. Now, Dr. Freeman is also a member of the Lyme Disease Task Force and has treated hundreds of patients who have Lyme disease. And next to me, the chair of the Cape and Islands Lyme Disease Task Force, Brenda Boleyn, has been a member of the faculty at Cape Cod Community College. Brenda has been very instrumental in forming, in actually shaping the actions of the task force and putting together forums for physicians every other year in which we bring forth information to help doctors in emergency rooms and practicing nurses to recognize the symptoms of Lyme so that they can get early intervention in the disease. And I think I'm going to start off having Brenda give an overview of Lyme disease on Cape Cod. And take it away, Brenda.
Thank you. Yes, just a couple of words about the task force. We were appointed more than 12 years ago by the county commissioners, and the focus of our work has been public education and field research, and as George mentioned, holding public forums for professionals when we could. I think we've had some influence. I think people on Cape Cod are better informed, certainly than they were before we started, and so that gives me some heart. But it is a very complicated topic with many unanswered questions, and it can be a diabolical illness, as some of you in the audience are aware. I want to thank the sponsors for this. It's really a very important subject on Cape Cod, and it's good to have a chance to share some of this with you. What you have found in your chair, I think, was an outline. We do not intend to give a program on all these. These are simply talking points of pieces of the Lyme disease story that we think are of particular importance to the public. Probably nobody needs to tell you that ticks love Cape Cod. They love the weather because it stays moist here so long, and they're here year-round. They don't disappear in the winter. They become a little less obvious, but they don't disappear. The handouts have been mentioned. There is a great deal of information for you to take home. And that should sort of reinforce some of what you hear this evening, and you'll find the terminology spelled out there with definitions for many things. I think you'll find that very helpful. And one of our most popular items is the wallet ID card. So make sure you take home a wallet ID card. I'm also proud to say that the wallet ID cards, and there's also a pamphlet there on managing tick populations near your home, have been developed by the county, the task force, and largely our entomologist, Dave Simser, who has done all the graphics and prepared all of this written material. The Massachusetts DPH is sufficiently impressed that they have adopted our educational materials, including guidelines that we developed in our education subcommittee that we developed for the schools. How to teachers to handling field trips and youngsters and repellents and so forth. So this has all kind of had a growing effect and influence. Real quick, I'm just going to run through this list here. Tick identification. How to tell a deer tick from a dog tick. A nymph from an adult. These are important distinctions. That little wallet card will help you do that. Keep it handy near your door or someplace where you can turn to it from time to time. Tick behavior, cycles and seasons and trends. I think that Dave Sims is going to address some of this. Ticks do not fly or jump, for instance, so there are important things to keep in mind about ticks. Preventing tick bite. You've probably all heard about wearing light-colored clothes and tucking your pants into your socks and so forth. These things really do work. The ticks don't care what color the clothes are, but you can see them more easily if you have light-colored breeches on, for instance. And the daily tick check. Nothing's more important than that. Reducing ticks in the yard, there's a wonderful pamphlet up there. Make sure you take one of those. It'll be helpful. Care of pets. Pets are a very, very important part of many of our households. You may walk in the center of the trail, but I can almost guarantee that Fido won't. He'll head right for the edges of the trail, and that's why your dog probably picks up many more ticks than you do when you come back from the walk. What to do when you find a tick. I get lots of calls about this, and there's some very sensible suggestions about what to do when you find a tick and how to properly remove a tick if it is attached. Then you may have questions about whether or not to get a tick tested. Diagnosis involves symptoms. As many of us know, diagnosis for this illness can be very tricky. It's very, very tricky for the doctor and for the patient with confusing symptoms and so forth. But we've learned to look for the so-called bullseye rash and so forth, and we've all heard about blood tests and possible co-infections. Again, the fact sheets up there will discuss some of these possible co-infections. And then, generally speaking, antibiotics are the first choice for treatment. I will stop there because, as we know, we will run out of time, and we wish to be guided by your questions. So let's see. We're going to turn now to you.
I'd like to check, to mention one more thing. Brenda mentioned the tick removal, and she's got this beautiful little tick removal tool, which is available in a number of stores, but I noticed today that she's actually wearing one as a necklace. Now, that's true dedication to tick removal. So, we'd like to hear a little bit about the occurrence of the tick on Cape Cod, things to look for, and there's no better person to talk to about that than Dave Simser. So, Dave, take it away.
Thank you, George. I'm sure there's about 12 other people that are better, but at any rate, here in Cape Cod, again, ticks are a way of life. They are here, no matter, we like to think and wish them away perhaps, but they're here. Basically, we have 10 or so species. The two major or important species that we have, and the ones that always get confused back and forth, are the American dog tick and the deer tick. The deer tick is also known as a black-legged tick. The dog ticks do not transmit Lyme disease, and we're typically going to find them around the beach. So when people are taking a beach stroll, swearing up and down that a tick came flying through the air and landed on them, or you're walking through beach grass and you get 150 ticks on you or on your dog, those are typically American dog ticks. They can carry things like Rocky Mountain spotted fever and transmit tularemia, but they are not implicated in transmission of Lyme disease. So our focus then tonight is really a species that we have here called the deer tick. In my surveys that I've done in all the 15 towns in the Cape and on both islands, they're ubiquitous. They're everywhere. In just about any conservation area that I walk in with my little white flag, dragging a flag around, I'll find ticks. Certain areas are more intense, have a larger population than other areas, but for the most part, if you're walking in the woods, or if you're working in the woods, the interface between your lawn and a wooded area, you're very likely to find ticks. You're very likely to find deer ticks. So let's focus on them for a little bit. The deer tick, as we have it here, has a 2-year life cycle. So they go from egg in about August through another August, and then finally eggs are deposited and the larvae hatch out the 2nd August. And what's confusing is because you have this 2-year life cycle, we have overlapping generations. So that at any given time of the year, we can have a couple different life stages present. The deer tick goes through 4 life stages, being an egg, a larval stage, a nymph stage, and then the adult stage. And in that time, they only take 3 meals, 3 blood meals. If you can imagine eating only 3 times in your life. Incredible. So what we have right now, on June 15th, is a population of nymph ticks, what we call the even-year population, but we still have a remnant population of adult ticks, the odd-year population. So when I go out with my flag, I'll find 2 different representative life stages. And that's a little bit confusing for folks saying, how can you have both things showing up at the same time? That's typically what we have. Right now, from about, call it May 15th to August 15th, we're in the high-risk period, because this is the time that the poppy seed size nymph ticks are present. What we also do, what we've done for years, is determine how many of these nymph ticks are infected with Lyme disease. And typically, in any given cohort of ticks, anything that we look at, it's between 15 and 20%. So you have a 1 out of 5 chance, if a nymph tick gets on you, a 1 out of 5 chance that that tick will be infected with Lyme disease. Where we've now turned our attention, because in the years past we've really been funded to look at Lyme disease, to look at Borrelia, we're starting to look at co-infection now. And what that means is, if you get a tick on you, what are the chances that it can transmit more than one disease? Can it also transmit babesia? Can it also transmit anaplasma? And what we've only done a couple studies, but basically, with an adult tick, about half of them are infected with Lyme disease, about 30% with anaplasma, 20% with babesia. But the real knocker is that somewhere around 15% have more than one illness, and 5% of ticks have all 3. And one of the reasons people might have more of a severe reaction or more of a severe illness is because they contract more than one disease. So that's something, again, that we're going to be that we are focusing on now, is looking at co-infection, and it's information I want to pass on to physicians and physician assistants so that they will be able to look for more than one disease in a patient. That's it.
All right, thank you. Well, we've sort of are entering into the question portion of the program, and if you do have any questions, please write them on the ticket and slide them off to the side. And I see here we've received our first question. I don't know quite where it came from, but it's really to bring things back locally to you in Orleans to understand what really is the instance of Lyme in the population of Orleans, and it's for Mr. Canning. Could you please explain what the threat is to the Orleans citizens from tick and Lyme disease? Bob?
Absolutely. Tick-borne diseases are not uncommon in Orleans or throughout Cape Cod. We know this because they're reportable diseases to the Department of Public Health. So if you go to a doctor and you're identified as having Lyme disease, they have to report that to the state, and we're able to take the information from the state and find out what the incidence is per town. I've done that for the last, for this meeting, I prepared the information for the past 5 years, 2005 through 2009. And I want to make clear that these include all reported cases. There's confirmed cases, there's probable cases, there's suspect cases. The difference between those classifications is really based on how they've been identified. It's a rigorous identification process, and you would have to have a number of either blood tests or clinical signs or exposure risks to be a confirmed case. So this includes confirmed cases, probable cases, and suspect cases, but all of them are cases. Really what I came up with, we have had about an average of 43 Lyme disease cases per year over the last 5 years. Ehrlichiosis, we've had 5 cases, and babesiosis, we've had 16 cases. So about 1 a year and about 3 a year for those diseases. Understand when the ticks are most active is probably when the population in Orleans swells. And it's swelling with people who are not Orleans residents, permanent residents. If they have exposure to Lyme disease or to a tick and contract Lyme disease, that's not reported as an Orleans case. That's reported as a case for wherever they're living. So when we look at these numbers, we're talking about individuals who live in Orleans on a basically a year-round basis, and you know, that's a pretty high number for a small population. What makes it important, and really why we're having a forum like this, is you know, the public health concern with these tick-borne diseases. They're preventable through proper use of repellents, proper clothing, identification, self-examination. You should be able to hopefully identify ticks, prevent ticks from being on you and embedding themselves. And also, with a high degree of success, they're treatable. And you know, that being said, if people are aware, even if they don't have the identification, but they can recognize the signs and symptoms of Lyme disease, they can go to their physician and describe, you know, where they've been, where they've had their exposure, did they have a rash, and you know, working with their physician, have a diagnosis of a tick-borne disease. So very important that you both try to prevent it, which of course is what public health is about, is prevention, and then early detection if by chance you don't prevent it. So we have it in Orleans, we have it throughout the Cape. I don't think it's a surprise to anyone that it's in Orleans. And we have quite a number of cases that are in Orleans. And those are people who are here year-round. Again, it does not take into account the summer population that swells when the ticks are active, and then they go and they're reported as having the disease to the town in which they live.
No, thank you, Bob. The next question relates to sprays that might be available for ticks that are non-toxic to people, birds, dogs, etc.
Good luck with that.
Is there one?
Yeah, I guess the question then is what magic formula could I use to treat my yard? And you know, absolutely there isn't a magic formula. We have EPA-approved materials. If you do elect and select a pesticide to spray in your yard, you want to be sure to address the ticks, deer ticks or ticks are on the label for that material. You can pick up, things change on a regular basis here in Massachusetts, but you can pick up either a liquid spray or a granular formulation. If you are going to use an EPA-approved product, this is the time of year to do it, actually a little bit early, sometime around mid-May to around May 20th to go after that nymph stage, the population. There's no from a standpoint of, geez, is there a great organically based thing that I could spray around? There really isn't. If you do, again, go with a pesticide, an approved pesticide, just be sure that it is listed for ticks, for tick control. There's no need to do it on a regular basis. Once or twice will take care of the job. There is some information, once again. I urge you to grab a copy of Property Management to Prevent Deer Ticks. There's a link on this to a guy named Kirby Stafford from the Connecticut Ag Experiment Station that goes into great depth of spraying for ticks in your yard or hiring someone to spray for ticks. So if you elect to do that, again, just choose a material that is listed for ticks. And that's the sad story of the way things are relative to tick control.
Okay, thank you. This one's for Dr. Labnan. My dog is on Frontline, and I often find small dead ticks on the dog. Does Frontline actually kill ticks?
Yeah, Frontline will definitely kill ticks. We are seeing some resistance, and I think probably anybody who has pets here have noticed the articles in the Times and things this spring about the dangers and the problems associated with topically applied pesticides, and they are pesticides. Those articles are justified, if somewhat sensational. Frontline was introduced quite a number of years ago, and when it revolutionized tick control on our dogs and cats. It was introduced in Canada and Australia and South Africa prior to the United States, and we have been getting reports from those countries for several years now of increased resistance to Frontline. The good thing about Frontline, though, is it is very safe. The articles that you had read in the paper, actually, those products related to permethrin products. Permethrins are not new. We had permethrins long before they were topical, and you were using them as sprays or dips or shampoos and things like that. They do not have nearly the safety margin that the Frontline, which is Vipronil, has. So there's a trade-off. The permethrin products do appear to be a bit more effective, although there's some indication maybe we're seeing some resistance there too. We may be losing this battle. But you have to balance that perhaps with the safety issue. So Frontline is safe enough that those who use Frontline, I now use Frontline myself with my own pets. I apply it at 3-week intervals as opposed to 4, particularly in the spring and in the fall when we seem to have our major problems. And there's no problem doing that with Frontline. I would not recommend doing that with some of the other products. The other thing to recommend or to remember when you're applying these have to go on the skin. They use the surface oils of the skin as a surfactant, and that allows them to spread across the body of your pet. Then this is absorbed in the sebaceous glands in your skin, and as they secrete during that month period, the Frontline or whatever you're using is renewed. All right, so that's why it lasts a month. Dogs that have skin diseases or various other problems or perhaps need more frequent bathing, you will not get a full month out of that. But you certainly are safe to use Frontline at 3-week intervals, even though that's off-label use. I do not recommend that with the other products. The problems that we had, that we have seen in our office associated with these things have almost invariably been they've been misused. They put the dog permethrin product on the cat, and they frequently don't live long enough to get to the hospital. Or they've used the wrong size and the wrong size pet, or that type of thing. We have had actually 0 problems of any significance with Frontline. Okay. So you have to balance that. There also is a product out there called Prevent Tick Collar. That's a pretty potent pesticide. It is quite effective, but don't recommend use in small dogs, and they absolutely cannot be used for cats. And if you have children or grandchildren that like to hang around the dog's neck, I don't recommend that product either for those things. So bottom line, Frontline will work. You can use it a little more aggressively, and make sure you get it on the skin. If you've got a greasy spot on the hair after you applied it, all of that that's on the hair has not distributed and is really not doing the job for you.
Thank you very much. That woke me up when you said pyrethrin for the one on the other, definitely. Dr. Freeman, is there a vaccine that can be used to prevent Lyme disease in humans?
I guess vets have a vaccine, but the experiment use of the human vaccine is no longer.
Okay.
This was, probably 5 to 10 years ago, novel idea of providing antibodies so that as the tick squirts the bacteria into your bloodstream, the antibodies will then attack it. So it's like working on the tick's stomach. Bottom line is, didn't work, off the market, probably too many reactions to it, sort of like the swine flu things. I mean, looked very good, but not available. I have a question about the Frontline. I keep wondering, why don't humans get Frontline? I mean, we've got DEET, but DEET's a day, and if this is good stuff, farmers and gardeners and people who are really exposed, I think there's a good possibility.
Frontline is not a repellent. Okay,
Yeah.
so ticks will get on
Yeah.
the dogs, and then if it's doing its job, then they will die before they're able to feed, and they can't transmit diseases until they feed. But it's not a repellent. Advantix, which is a permethrin product, does claim to be a repellent.
Yeah.
I will
think the
confess,
dogs
I have
have it.
actually put some on my boots and the lower part of my pants. So.
Okay. I mean, this is all off-label, of
Right.
course. But there is a need for that sort of thing, certainly.
Dave, do you recommend that people drag a white flag around their yard to see if they have ticks? Could you repeat that question?
The question is, Dave, do you recommend that people drag a white towel or flag around their yard? And I was just thinking about that. When I do a survey, it's not rocket science or tree surgery. We basically take a piece of square meter of double-sided flannel, which would be just like a towel, an old white towel, and it's quite remarkable how this towel picks up ticks. So one thing you could do, I see no reason why, just be careful. Just know that you're in a ticky area. Take a towel, attach it to a broomstick, handle like that, and walk along this time of year, perimeter of your yard, just get into the woods a little bit, and every minute or 2 minutes or so, just stop. If there's a breeze blowing, don't let the towel fall into your face. Not a good idea, bad technique. Hold it out, takes a little bit of doing, and you can actually see if you have a tick population in your yard. So I do recommend that, as long as folks are careful about doing it. And you might, I don't know if it's going to get to the point where you could quantify whether or not your tick control worked or not, but all it really does is let you know, it alerts you to the fact that you do have ticks at that border between your turf, your lawn, and the woodsy area. So why not? Again, just be very careful. Wear white pants, white socks, use a permethrin spray that we'll get into down the line as a repellent, as a tick-killing agent. But there's no reason not to check your own yards and see when, because it just increases awareness for us all. Ticks are usually on the back burner, and this just brings it out more to the front burner.
David, question on that. Now you're dragging this thing across, and the ticks are dropping into it?
Oh, absolutely not. Absolutely
Okay.
not. Absolutely not. Ticks don't drop. People find them, and I also recommend cutting your beautiful hair at this time of year so you can find ticks easier. You find ticks on your head because they move, once they get onto a suggested host, they move up, away from gravity. And a lot of times with deer ticks, we'll find them on our heads or necks because that's what they do. They search upward on a host to get away from the feet, because typically if you have a non-human host, you can groom that area easier. So if you get higher up, it's harder. It's obviously hard to groom something that's on your head. So when we drag, what we're looking for are ticks that are very low to the ground. Deer tick nymphs, how do we get a tick? How do we get a tick on us? Deer tick nymphs are just about ground level, because what they're trying to do is find a mouse or a scuttling bird. Those are their hosts, or chipmunk. So when we're doing something in our yard, if we're kneeling or walking, the point of attachment is our shoes, or perhaps our knees if we're on the ground. This is where a tick gets on us, and then they move up. So going back to our question with the flag, they're not going to be descending from trees or dropping down. They're going to be down on the ground, grabbing onto that flag. So we pull that flag as close as we can, just right along the ground, again, for count to 30, that's what I do, and then check it. So you're grabbing things, because what a tick does, what a deer tick does, the way they hunt, they're not little tigers. Well, in the way they are, they wait. They have an ambush strategy. So all they're doing, they're not seeking us. All they're doing, you can imagine being in a restaurant waiting like this. They have their forelegs in the air. They have little sensors on those forelegs, and they're just waiting for a host to pass by. And they're very good at clinging onto things when that happens. So if a flag comes by, or a pant leg comes by, or a shoe comes by, that's what they grab onto, and then they get busy.
So safe to say they don't drop from trees?
They don't drop from trees.
They don't drop from trees, for the person who asked that question. Dr. Freeman, could you discuss the sort of added sort of danger for somebody who doesn't have a spleen or babesiosis?
Someone without a spleen is subject to a number of different things. In terms of the babesiosis, I think pneumococcal pneumonia is much more of an issue. But there would be some increased risk. How much there is, I don't know. I think with babesiosis, it's a fairly aggressive infection. People are really sick. And the comfort is in quick treatment and appropriate treatment. There certainly is no protection available for anyone who has lost their spleen. You can't get a babesiosis shot like you can get a pneumovax or a flu shot or anything else like that. Anyone without a spleen, you have to be a little bit more aware that your general reaction to any number of infections is going to be slower. Treat faster.
Another question for you about
Sure.
doxycycline.
Yep.
In co-infection, is a doxycycline sort of a cure-all?
Doxycycline is primarily for the Lyme disease. You have to go to laminar, other antibiotics, erythromycin, things like that. We use a lot of doxy because the number of cases of Lyme disease is so much greater. I mean, 99% greater than, so that's our standby for that. Doxycycline cannot be used in kids. We have to shift to amoxicillin or a cephalosporin.
Okay, back to Dave. Well, it's like a ping pong match here. Do ticks prefer certain habitats over certain types of flora or anything like that?
Okay, the question is, do ticks prefer certain types of habitats? And absolutely. Again, when we're talking about American dog tick, that's an animal that can tolerate dryness. So we're typically going to find them in open fields, areas around beaches. They're searching for meadow voles, coyotes, things that are going to be in that open area. Deer ticks are very susceptible to drying out, so they're typically going to be in wetter areas. But I'm confounded why certain areas on the Cape, such as Dennis Pond in Yarmouth, such as the Punkhorn in Harwich and Brewster, have so many ticks. Why are there so many ticks present in these areas? Sure, it's more moist. Typically, they're found in a swampy area, deciduous area, and that's their preferred habitat, if you will, if they have hosts present. deer ticks. But I've also found them on Nantucket. I found them in piney woods. Huge population. So I guess the answer then is deer ticks do prefer moist areas, swampy wetland areas, as opposed to drier areas.
Thank you. Dr. Labden, presentation of Lyme in a pet. How does it present?
Well, we're talking about dogs because at this point we don't recognize Lyme as a problem for cats. This is a big subject. The acute case of Lyme disease is a fairly classic case in the sense and probably very similar to perhaps people in some respects. The patients come in, they're febrile, they are lame, usually multiple leg lameness, swelling of joints. They frequently have enlarged lymph nodes. They're off their food. They're anorexic, and they don't want to move. They're obviously very sick dogs. They also respond extremely quickly. Treating acute Lyme disease really does not present much of a problem. When we make that diagnosis, and we make that diagnosis on the average Lyme diagnosis in our hospital, about last year I looked it up, with 542 times. A relatively, little bit less than 50% of those patients actually are symptomatic. We have, for a lot of different reasons, if we can go into if we need to, there are a number of patients that we treat for Lyme disease that are not showing symptoms simply because we find that they have such high levels of certain immune complexes. They're subject to a disease that is not common, but fatal, that affects their kidneys. So we see a lot of Lyme disease. Now, acute Lyme disease, that's a diagnosis made in veterinary medicine, I guess probably by what we call the duck method. If it looks like a duck, sounds like a duck, walks like a duck, it's probably a duck. Because in acute Lyme disease, if you take a blood sample when they have acute Lyme disease, it is not going to show that they, in fact, are even exposed. They do not begin producing the antibodies that we pick up on a blood test for several weeks until after by that time we have the dog has generally responded. So that diagnosis of acute Lyme disease that fits in our category that we would report or as Lyme disease, that's how that diagnosis is made. When we have the opportunity and with a willing client, we do subsequent blood tests over a period of time, and that helps to solidify that diagnosis. But that's how they present. They respond extremely quickly to doxycycline, usually within 48 hours. They're acting particularly normal. They stay on antibiotics for a full month, but they are clinically back to normal very quickly. I would also say that probably we almost see as many dogs exposed to anaplasmosis as we do to Lyme disease. Pretty close. It's getting pretty close to even.
Thank you.
I have a question. If you have a dog who's 5-7 years old and nothing much is going on, just the get up and go, got up and went, looking a little arthritic, do you test for Lyme and find it? I'm looking at chronic.
Very frequently. Very frequently.
Very frequently you find it.
That's correct.
And no exact change in health, gradual decline.
That's always a test that we run. Of course, as you know, finding the organism, establishing the organism is present, is a little different than establishing that the organism is the cause of the problem. So interpretation becomes more, particularly the chronic cases, and you would be referring to a chronic type case. It becomes more difficult to evaluate those results.
Thank you. Brenda, where is the state going with this? Where is the Commonwealth of Massachusetts? How are they what's their strategy for outreach, for education, for actually getting the word out?
Well, I don't want to toot our horn too loudly, but the doctors at the Department of Public Health wish that they could establish task force groups in other areas of Massachusetts to promote the education piece as we have on the Cape and the islands. But as you know, the budget cuts have really taken a serious toll. Our Lyme Disease Task Force was funded very well for 10 years, and we were able to host meetings, and we were able to print volumes of materials like the cards and the rack cards and so forth. And now that our funding has been lost, we're not able to do that. But in fact, statewide, the opportunities for funding are even less. And so it's being done on a volunteer basis sporadically in different places. And to answer your question, I think the Mass DPH would really very much like to be able to do a lot more outreach, and especially with the schools, than they've been able to do. I will say this, that when we started 12 years ago, we visited the Department of Public Health, and they told us that they had far more important diseases to pay attention to. They were worried about, the mosquito-borne diseases and so forth, and it was very difficult to get them concerned about Lyme disease, but it only took a couple of physicians up there, and when we held our first meeting, it was in December of '98, I remember it well, 5 members of the Department of Public Health came to that meeting, and they went back and they established a statewide committee to do the same thing. So that was a significant turning point. However, starting a group is often easier than keeping the group going. And when you have very busy people serving on these committees, it's not easy to keep the meetings constant and keep them coming. So what we've been able to do, I think, is identify those people who are resource people who are interested enough to participate and turn to them. And so that's what they're trying to do statewide as well.
Now, what about the other tick-borne diseases? For instance, ehrlichiosis. Are they getting better at diagnosing these, or?
It's
Dr.
my
Freeman
understanding,
could
and Dr. Freeman can help me with this, that testing is far more precise for the co-infections such as babesiosis and anaplasmosis, which is now the name for ehrlichiosis. So those get confused by those a couple of times. But the testing for those is far more precise, so it doesn't present the same kind of diagnostic dilemma that Lyme disease often does.
Are doctors reluctant to have the test done for
Pardon me?
these? Are doctors reluctant in emergency room settings, for instance?
Oh,
to-
I think if you go to Martha's Vineyard and you have anyone coming in sick, they have an excellent pathologist, and they'll read the blood smear right there. I mean, they're very, very aware of that. I think that, yes, the tests are more reliable. They have a lower false negative, false positive, so that if the test says yes, it's pretty good. If a test says no, probably not. That's the problem with the Lyme disease, is that we're in some cases we're looking into actual blood smear, and you can see the organism. Most of the time it's looking at the antibodies that you form. In other words, it's not the bug itself, it's your body's reaction to the bug. That's a little more difficult to get. And so there's a time lapse between exposure and when your body start making these antibodies. Makes for more false positive. And in the case of Lyme disease, the nasty little spirochete can sequester inside of cells and is not in the bloodstream. And that makes testing that much harder. So the tests for the other two are just fine and reliable. I mean, very, very reliable. When the test comes back negative for Lyme disease, that's sort of evidence, but doesn't tell me an awful lot.
Could you speak a little about the rash?
Sure.
Does everybody get it?
Absolutely not.
There's this question about only 60% of the people getting the rash.
Right. If it's 60%, I think that might be a little high, because so often people get sick and they didn't see the rash on their back. and the rash came and went. And so reporting a rash is part of observation that may get overlooked. If they miss the tick, they can miss the rash just as well. So 60% is what's quoted, and that's upper level of things. The rash is also not necessarily just the bullseye rash. I have seen an arm which was swollen to here. You couldn't tell if it was a blood clot or a cellulitis, or really very different. The rashes are sometimes very unidentifiable. If you have a nice little, and the rash spreads like that, that's great. Then you got the diagnosis. But there can be a lot of rashes which are Lyme disease, and they just don't look like anything you'll find in a textbook.
How about a relapse of symptoms? Can you get a relapse of symptoms without getting another tick bite?
When you have had a exposure to a pathogen who is damaging these cells, you can always get rid of all the bugs, all the bacteria, and still have damage to where they were. That's always the case. If you have tuberculosis, you may have scarring in your lungs. Tuberculosis is all gone, but you still have some scarring. Similarly with Lyme disease, it's really hard to tell whether a relapse is a reemergence from these ticks which have been sequestered and hiding out, or a new infection. So many people don't know where they got the tick bite. So, it just comes out of the blue. No, the 40% who have no rash probably have no memory of a tick also. And so you never know whether it's a new one or an old one. The test actually breaks down into two types of antibodies, one of which is an early antibody and one is a long-term memory antibody. And you can get a hint from that if your early antibodies are going down and your long-term antibodies are coming up, that probably means it's going away. There's no test to say you're done. There's no sense in retesting, because just like when you get a shot for Haemophilus or pertussis or anything else like that, any of the things, those antibodies stay around a long time. So that the tetanus shot needs to be redone because your body needs to have more tetanus antibodies, and you can't tell when the bacteria, when the infection part is gone.
Oh, thank you. Back to Dave for a slash and burn question. What about burning to control ticks?
The question is, what about burning to control ticks?
Get rid of the tent caterpillars.
It's actually been studied. Sure, if you're going to set fire or have a prescribed burn somewhere, of course, all the ticks in that area are not impervious to burning, so they'll die. But what typically happens is you have a lot of good graze that comes along after the burn in areas where deer and mice like to habit, particularly deer. So it turns out that if you burn an area, you might get some short-term relief, but over the long term, you'll actually find more ticks because they're dropping off of deer, for instance, and setting up shop in those areas. So again, burning is a short-term solution, but overall will actually increase ticks in that area.
Oh, stop burning, folks. Whoever asked that question, don't burn. Dr. Freeman, this is a question I hear a lot. Somebody gets a tick on them, and there's no evidence of anything, but they want that shot of doxy just in case. What sort of the medical communities stand on that, and what's the efficacy of doing it?
That is a very important question, because how you are treated or not depends on the philosophy of your doctor, not on science. There is science that if you have 2 doses, I mean, there's very little study on this, 2 doses of doxycycline would decrease the incidence of Lyme disease occurring in the next 3 months. Some physicians will not treat at all until you have a positive test. That's 2-3 weeks later. And if you have the disease, you've gone without antibiotics for those 2 to 3 weeks. That is a convenient philosophy because you always have something written down black and white, and I guess that's comfortable to some physicians, that you're only treating a positive test. I find difficulty with that because I know that there's an interval with people with bacteria proliferating in them that are not being treated. I own it as my own philosophy, and this is not going to happen in the regular thing, is I'd rather treat 100 people who don't have it and not miss the one person who does. And that is not happening in a lot of cases. If you go in with a tick bite to your doc, you may say, well, let's wait until the test is ready, or things like that. The Cape Cod community is not tick-friendly, not Lyme disease friendly, because the philosophy by our infectious disease chairman at the hospital is that there is no such thing as chronic Lyme disease, and that 30 days of doxycycline is all that anyone needs ever. And it's a matter of philosophy. It's very embarrassing to me, frankly, that medicine is being torn by persons' philosophies rather than by science, rather than looking at it. But that's the way it is. That the Cape Cod Hospital is, and a lot of physicians are not treating until they have a positive test, and will not treat beyond 30 days because they said, the science. In fact, that has to do with a group of physicians who took over the Infectious Disease Society. And of course, that's the gurus. I mean, these are the mecca. This is the folks who really know stuff. They formed a committee, about 10, 15 years ago, and there was debate about what to do with it. And since there was debate, they dissolved the committee. Then a few years later, they reestablished the committee, and all the physicians who said there may be chronic Lyme were not invited. So only one who got the invitations to forming the opinion of this prestigious scientific group were people who already had the philosophy that there is no such thing as Lyme disease. The Attorney General of Rhode Island sued him and won and said, go back to your drawing board. I don't care what you come up with, but you can't stack the jury like that. When the Infectious Disease Society of the United States said there is no such thing, then the Neurology Society said, oh, those people know infectious disease. We don't think there is either. So that as you go for your primary care and what to do with your tick bite, you're going to run people who follow the word of the Infectious Disease Society and believe it as truth, or who are treating off-label, because there is no good science on it yet. And there's not a lot of research being done on it either. And it's a matter of philosophy, and just be aware of that.
Thank you. Testing the ticks. What about it, Dave? Test the ticks for the presence of Lyme.
Is that in the form of a question?
That's in the form of a question. Is it a good thing to do
I
if
think
you've
the
got a tick on you and,
Yeah.
it's definitely fed and had its meal, and you're thinking about, do I go to the doctor or not? And check the tick?
I think the question was, check the tick? So, basically, there are organizations, there are groups, there are companies that will test a tick that is sent in to them for the presence or absence of Lyme disease, Babesia, or Anaplasma. And this is really, I consider it to be a real double-edged sword. So for instance, you get a tick, you find you have a nymph tick on the back of your right ear, and you remove it properly, which we'll get into down the line, and you say, well, geez, I was in the woods on Saturday. It's the only time I've been in the woods, so probably this tick has been on me for 72 hours. I don't really want to take doxycycline. Can I get this tick tested and see whether or not it has an infection? So again, there are numerous companies that will do this. We have a partnership, an alliance with the University of Massachusetts. So we typically will send in a tick with the check for $40 to UMass, and they will test that tick using a method called PCR and determine whether or not that tick is infected. And that usually takes about a week. So what's going to happen is if you do that, you'll get a result back in about a week, and if, in case, the tick is infected, you can say, aha, the tick's infected, it's been on me, I know it's been on me for 3 days, go to your physician, I think we should, and in consulting with the physician, start a course of doxycycline or amoxicillin or erythromycin, whatever, we should start this. So it gives you kind of a heads up. The problem with it is if you've had this tick on your right ear, but you didn't notice the tick on your left ear. So you take this tick and you get the tick in your right ear, and it's tested and it's negative. You go, aha, no problem. Okay, great. But you contract Lyme disease because you didn't notice this other one. Therein lies the problem, the other edge of the sword. So I think that philosophically, at least for me, sending a tick in to get tested maybe gives you a little bit of peace of mind. That if it does come back and it's negative, you can say, okay, that tick was negative. But it doesn't mean that then you're immune from any subsequent bites or any ticks that might be on you. So again, I guess the short answer is tick testing is available. At Cooperative Extension, we're very happy to help you. We'll get you set up and you can send it off. It takes about a week, and it's really up to you to determine how to interpret that information.
Thank you. I appreciate the succinctness of this next question, which is, shoot the deer, question mark. But the sort of longer version of that is, has the prevalence of the disease been reduced by reducing the deer or the mouse population? I thought it said house, but I'm figuring it must be mouse. So, if you reduce, you again, yes.
I'm all over this question. So the question is,
Reduce the deer,
shoot the deer?
Yeah.
You probably heard or read. Okay, from a biological standpoint, the two important hosts for deer tick are white-footed mouse, a field mouse, and white-tailed deer. If you have an area, which we do, that has mice and deer, the mice are active in continuing the infection. The deer are active in providing blood so that the ticks can lay 3,000 or so eggs. So the question is, in areas, if we remove the deer, what will happen to the tick population? And there's been a couple studies done in island settings where they've either really dropped dramatically the deer population, which they did here in Great Island, for instance, in Yarmouth Port, or they've extirpated, they've removed the deer, which they did in Mohegan Island in Maine. In both cases, those are very special considerations. In Mohegan Island, the only other mammal really that's there are rats. It's a very, very limited population of mammals. Here on Great Island, we still have ticks with Lyme disease because I personally have walked out there with my trusty flag and found, I wouldn't say unlimited ticks, but a pretty healthy tick population, half of which had Lyme disease. So I guess shooting the deer, and it's a very involved question, shooting the deer, getting rid of deer, will limit somewhat a tick population. But me being a deer lover, I guess, I can counter with by saying, here on Cape Cod, we have a managed deer population. We have a population of around 6 to 8 deer per square mile. And yet we have, dare I say, rampant ticks and rampant Lyme disease. And the other side of that as well is that some researchers consider deer to be a dead-end host, meaning that any tick that feeds on a deer will not get Lyme disease. Deer do not transmit Lyme disease to ticks. Only mice and chipmunks and some birds do that. So there's a lot of controversy that's going on. It's going on right now in Nantucket, where they're saying, should we get rid of the deer? The other thing about deer, say in an area of Nantucket, you're going to get rid of maybe 80%. It's going to be pretty easy, but you're never going to get rid of that 20%. That's going to be impossible. And that 20% will have many more ticks on them from a host standpoint. So what are you really getting? What are you getting down the line? You're not going to eliminate Lyme disease. You're not going to eliminate ticks. You might cut back on them over time. And there are many people that would be sitting in this chair right here going, he's full of baloney. They'll say, no, we've got rid of the ticks, we're going to get rid of Lyme disease. But I haven't seen it. You know, there's a lot of other issues with deer, 50, 60 per square mile like we have in the islands, where there are deer car collisions, where your precious hostas are being eaten, endangered plants are being eaten, things like that. But again, I guess management would be the way to go. Certainly in areas where the deer are running amok, there needs to be some sort of a management practice in place to reduce their numbers. But there's a lot of other reasons besides tick-borne illnesses to do that. So I certainly understand that it's not a cure-all, catch-all. Removing deer will not remove Lyme disease. What did I say?
Okay. Well, Dr. Freeman, is there any evidence of that diet can assist in avoiding the tick? Do people, for instance, who eat more sugar or garlic, or I know the garlic
really.
thing works on the
Not
vampires.
really.
I have never had one.
No, it's people repellent, but not.
I noticed that too, actually.
Right, yeah.
I noticed the distance here.
Yeah, I remember somebody who kind of overdosed on vitamin B before he went up to Canada because he said that you smelled so bad that the black flies wouldn't, little black flies wouldn't land on you. I don't think that was a controlled study, though.
Okay. So there's no real science to the diet piece of it? Okay. Could you speak a little bit about false positives? I mean, somebody gets a positive, but they've never had a tick on them that they know of.
Yeah.
Is there a lot of that occurs?
Not really.
Not really?
Not really,
Well, that's
no.
an easy answer.
Yeah,
then.
the way the test goes, the level of what you're looking for may be there, but not be good enough to trigger the test. Once the test is done, actually there's a two-pronged test. We do an ELISA followed by a Western blot. And the ELISA could have, and that's like when you do a dipstick for a urine or a strep throat or a monospot, it's a cheap little test. And that one can be turned positive for some other reasons. But that's never regarded. The Western blot is definitive. And they know the molecules, and they're looking for the particular molecules. When it's there, it's there. The only issue may be there's not enough molecules to turn the test positive. So there's a lot more false negatives than there are false positives.
Now this one I'm going to have to read verbatim because it's a little bit beyond me. Can you talk about the interpretation of Western blot for Lyme? What are the number of protein bands needed for positive diagnosis?
Yes.
If someone has most, but not all of the CDC required bands, and is symptomatic clinically, would you consider likely that one has Lyme?
With this sort of thing, where people are really on the edge, we know that there are all these Dalton bands. We know 21 does this, and 23, and 53 means more of a long-term thing. So there is a knowledge about these it looks like a strip. It looks like a checkout strip, what you go through on the for
Bar scan.
bar scan, yeah. And so you have to look and see as to whether how vigorous that one. Is that a dark gray? Is that a light gray? And so that the interpretation is a little tricky. If I had a patient who had 23 and 52 and 19 and other things, I talk about it with them. So what do you think? I mean, science isn't totally there. And there's several different criteria. You can be positive by the New York criteria and negative by the CDC criteria. So that, if the scientists can't agree, what do you do? A lot of these antibodies were also established back at the Detroit, in a Detroit conference many years ago, and they've been using the same antibodies all the time. So that's kind of old, and now there's some places which are developing the new antibodies. It gets very complex, and there's a bunch of people who are, much deeper into medicine and research than I am, that could do a better job. I think when there's question, then the patient should be involved to understand the nature of the question and the fuzziness of medicine.
Oh, it's a little scary, the fuzziness of
The fuzziness, you don't know how often we're guessing, really.
Oh, I don't want to know, I guess. Don't want to know. Insect repelling clothing, Dave. Is there such a thing? L.L. Bean sells it, Orvis sells it. Is there such a thing?
What's your question?
Is there such a thing as insect repellent clothing?
The question is there such a thing as insect repelling clothing? And the answer is unequivocally yes. The material that is used typically is, some say permethrin, some say permethrin, is this pyrethroid compound. You can buy this stuff in a garden center, a hardware store right here in Orleans, and if you read the label, you can reading the label carefully, you can treat your own clothing with this material. There are things like Gempler's, LL Bean, Ex Officio, EXOFICIO.com, has a whole line of very stylish clothing that has permethrin impregnated into the cotton. And many researchers will advocate, Dr. Mather, for instance, will advocate using a spray of permethrin. If you're going to go golfing, for instance, spray it on your socks or your shoes or your pants. So the answer is yes, definitely. But if you elect to do this, permethrin is both a very good repellent and a ticicide, a tick-killing agent. If you elect to do this, the thing to do would be you would have some dedicated trousers that you use for gardening or for hiking, and you would spray or dip those trousers up to about maybe the thigh level, because that's where the ticks are going to get on you, about to the thigh level. Let them dry, and that'll actually be good for about 70 washings. Permethrin, one of the attributes of it is that it has great fidelity to cotton. It clings to cotton, so it remains in there. But again, if you want to pay $40, $50 for some stylish trousers, you can go on this site. They have a range of products. They even have bandanas for kids that have permethrin in there. So again, if we believe in things like the EPA, this agency has approved this material for wearing by humans, and you can go there with it.
Thank you, Dave. Dr. Labdin, I believe you answered this, but I'm going to ask it anyhow about cats. There are 3 questions on here, and I'm not sure fuzzy mat is a real technical term, but it says, can ticks live on a fuzzy mat inhabited by a cat? If so, washing the fuzzy mat kill the tick? And if ticks kill or eat mice and chipmunks, can they develop the disease?
I would say a mat is not likely to be a very good habitat for a tick, so I don't think that would be an issue. Now, fleas, on the other hand, would thrive under those circumstances. What was the second part of that question?
Well, if they kill or eat a mouse or chipmunk, can they develop the disease from the ticks that might inhabit that small furry animal?
Ingestion, cats, as I say, at this point we do not believe cats have clinical Lyme disease. It's not something we actually have to say looked at very heavily, but there's no evidence that Lyme disease is a problem for cats. And I also do not believe that an ingested tick by a dog or a cat would either lead to Lyme disease. The organism would be destroyed in the stomach by the stomach acids.
Thank you. Dr. Freeman, does anybody have immunity from Lyme disease by getting bitten by a tick that has it?
No.
Is there any evidence that anybody's immune?
No. It isn't like, any of the number things where when you have the antibodies, you're resistant to it. It isn't like the flu shot or anything else. The Lyme vaccine was a different spin because it was affecting the bacteria inside the tick as it came out. You can get it again and again. Having the antibodies is a marker. It's not a protection.
Okay.
It doesn't make your system recognize it and attack better, as it would with some other diseases. Unfortunately, not.
When one goes into to get tested for Lyme, do they generally run all of the tests for babesiosis,
No.
or ehrlichiosis?
No. The Quest has a tick-borne disease thing, which is which is the three. If a physician was concerned about babesiosis, person really sick, just like they're ill, then you need to do a blood smear rather than an antibody test. So there's a lot of differences. There's a lot of differences in what the tests are, and there's a lot of difference in where the laboratory involved will set its mark of negative or positive. And so that if you go to IGeneX, the mark is very high. When it's positive, If you go to, I can't think of other names right now, but anyhow, they set it very low, so they'll have a greater false negative.
So what's a per person to do who thinks, I've had this tick on me, I've heard from Mr. Simser that there's a lot of co-infection that may occur.
Ask for tick-borne disease screening rather than Lyme disease screening. That tick-borne disease isn't as accurate in some ways, but it picks up things very well.
And yet, every lab may have a different threshold.
That's right. What they do is they buy a kit. The laboratory will buy a kit, and then they run that kit. And the different kits will have different sensitivity, which is provided by it's tested by the manufacturer. I had one person who was involved with studies at Columbia University a number of years ago, and what they did is they tested him at about 6 different major labs across the United States. And it was partly a matter of testing the testers.
Right.
And he got different numbers. They went out to Palo Alto, they went here, it was a research situation. This is not what you do ordinarily. But I happened to see the results, it's from Palo Alto, this is from Mayo Clinic, this is from Cleveland Clinic, this is from and all the answers, they wanted to be sure in their research that they had somebody really with Lyme disease. That's why they did that. But there's variations.
So that doesn't seem to paint a real comforting picture.
That is why all the controversy is the testing is a little flimsy.
Yep.
Testing is flimsy. And so that if you're going to just do testing black, white, not look at the person, well, you're seeing the black and the white, but you're not seeing the person. That's all.
Dr. Freeman, can I address the question? My question is, does everybody who got the tick bite was infected with the Lyme, gets the Lyme disease?
Could you repeat the
What
question?
about
Sure.
you? If my immunity system is not protecting me, if I'm 100% protected? That's why I addressed the question, but wasn't answered,
Right. The question is, does everybody who is bitten by an infected tick
Right.
get Lyme disease? Probably. I say with great assurance. Yeah. If now the bite may be on too short a time, the tick will regurgitate some saliva. The bacteria, spirochetes, live in the gut of the tick, and they get activated when they see human blood. They start moving, the spirochetes, and the tick puts a little spit into you. I mean, that's why you don't feel it. That's why you don't. That's why you get a welt from a mosquito bite. When you're being bitten, you're also being spit upon. And once the bacteria are in the body and alive and going, then can your body fight it off? Perhaps.
Okay, I have to make a comment on that,
Sure.
okay?
Excuse me, I really believe that the sort of the protocol for questions would be through the card, which was decided by the forum and the Board of Health. And we really can't take questions from the audience, except in that format. I'm
Okay.
sorry.
Yeah.
Is there any such thing as borderline Lyme disease?
Well, I think that you can have an early Lyme, and actually as that little rash starts spreading out, that has been biopsied, and there are spirochetes in the skin of the rash as it spreads. As it spreads physically on your skin, it is spreading by the bloodstream to other organs. So rather than borderline, I'd put it more as early or late, localized or disseminated. Borderline might be that you had the bacteria, but your test is not. That's sort of a semantic issue. If the spirochetes are there, you got them. If they're not doing an awful lot to you, that's a possibility. You get a kind of a flu thing and stuff like that. If, where they go is sort of a chance issue. But if they're there, they're there.
Given sort of the uncertainties that we've discussed with the testing, and that you may get different results from different laboratories, and somebody who is real concerned, what would be your recommendation for the type of discussion they should have with their physician to sort of compel the most thorough analysis of their situation so they could sleep at night?
All right, if someone went in with a tick bite and pulled it out, heads out, and it is a deer tick, and their physician said, well, let's do some testing and wait. I think the question for that physician is, what happens if there are some spirochetes in me already? Why are we waiting for the test to come back? I mean, that's just a legitimate question for an informed patient to pose, because the patient does need to be involved with that choice. And see what the physician has to say.
So keeping informed
Yeah.
and asking those right questions, pursuing the line of question is the best you can do
Right.
with your physician.
Right. I mean, if physician is wanting to postpone treatment, question is why? And while we postpone, what could be happening? If you don't have Lyme disease, it's a moot question. Not a question. If you do have the spirochete, why is the physician postponing? I don't know. I mean, that's what you'd have to ask.
Well, thank you. Well, there were two types of sort of comments that I received that I don't think are quite appropriate for the forum to answer from any of the panelists. One was a type, there are three questions here relating quite specifically to sort of questions, medical questions that somebody had when they talked to their doctor. They only got so much doxycycline, what should I do? And I think what we've heard tonight is the best information you can get to pursue it with your own physician when you have those questions. And I know it's often difficult to do. You have a professional before you who's probably had at least twice the education that you've had, and he's gone to school or she's gone to school, and they're telling you one thing, but I think what we've heard tonight is Lyme disease is insidious enough that you need to pursue the questions with the best information that you can gather in order to pursue it right to the end so that you're satisfied. And if you're not, keep asking those questions. The other sort of vein of thought that we've gotten through a couple suggestions really speak to the education piece of it. More information needs to be out there. There's a question here about why towns don't make more signs, and I know that Dave could speak to that, how many signs are out in all of the recreational areas, but if there are 100 signs out, there probably needs to be more so that people are informed where they walk, where they recreate, of the dangers of Lyme disease without going overboard and making everybody afraid of nature. I think we have one question here. Here's a question, and I don't know who is the most appropriate person, so I'm throwing this in the air. What is your opinion, and I don't have one, so I'm not going to give it, of the movie on Lyme, Under Our Skin? Has anybody seen it, and how many Oscars has it won? Yes.
I've seen the film. It's a very compelling film. I recommend that anyone who's interested in Lyme should see this film. It certainly it tells the story of people who have intractable Lyme symptoms and what they have gone through trying to find treatment. My problem with it is it's too long. And because it is so long, professionals like physicians aren't going to have time to see it. They're not going to be able to make time to see it. So I would like to see some skillful film editor take it and reduce it to the highlights. I mean, every story is compelling, but if, it's like preparing a document for a politician. If it's 16 pages long, the politician may be only going to read the first couple of pages. So I think the film could be improved by some good, skillful editing. But if you have a chance to see it, I recommend it.
Okay. With that, I believe that we're ready to conclude the forum, and we appreciate everybody who submitted questions. Those that did have those specific medical questions, please speak to your personal physician. And we've heard tonight that your best sort of defense here is information. So thank you, have a good evening, and thank you for coming.
Thank you, George.